Have you ever wondered if vision correction surgery is right for you, but felt overwhelmed by the choices? Perhaps you have heard of LASIK, but what about PRK? It is natural to feel a little unsure when considering such an important decision. Yes, the risks associated with PRK, or photorefractive keratectomy, are indeed different from those of LASIK, or laser-assisted in situ keratomalysis, primarily due to the distinct ways each procedure reshapes your cornea. While both aim to improve your vision, the approach each surgery takes leads to different recovery times and potential side effects. LASIK involves creating a thin flap on the cornea, lifting it, reshaping the underlying corneal tissue with a laser, and then carefully repositioning the flap. This flap acts like a natural bandage, allowing for faster visual recovery. However, the creation of this flap introduces a unique set of potential complications, such as flap displacement or issues with flap healing. On the other hand, PRK removes the outermost layer of the cornea, called the epithelium, entirely before using a laser to reshape the corneal surface. The epithelium then regenerates naturally over several days. This means there is no flap-related risk, but it does lead to a longer and often more uncomfortable initial healing period. The primary risks for PRK involve a higher chance of temporary haziness of the cornea or a slightly increased risk of infection during the epithelial regrowth phase. Both procedures carry general risks like dry eyes, glare, halos, or under or overcorrection, but the nature of the unique risks varies. To help you decide which procedure might be a better fit for your eyes, ask yourself a few key questions. First, consider your lifestyle and recovery expectations. Are you able to take a few days off for a potentially more uncomfortable recovery, or do you need to return to normal activities very quickly? Think about your specific eye health, such as corneal thickness, as certain conditions might make one procedure safer than the other. It is also important to discuss any occupations or hobbies that could put you at risk for eye trauma, as a LASIK flap could theoretically be dislodged by a direct impact. Finally, carefully evaluate your personal tolerance for discomfort versus your desire for immediate visual improvement. An interesting point is that PRK is often recommended for individuals with thinner corneas or those involved in high-contact sports or professions where eye trauma is a concern, such as military personnel. This is because without a corneal flap, there is no risk of flap-related complications from an impact. The long-term visual outcomes of both procedures, meaning 10 years or more down the line, are generally considered comparable for suitable candidates, though LASIK typically offers quicker initial gratification. Many eye care professionals refer to PRK as the surface ablation technique because it works on the surface of the eye. Understanding the specific differences in how LASIK creates a corneal flap versus how PRK removes and regenerates the surface layer is key to appreciating their unique risk profiles and recovery paths. By knowing these distinctions, and asking the right questions about your lifestyle and health, you empower yourself to have a more informed discussion with your care professional, ultimately leading to a confident decision about which vision correction path is best for your individual needs and circumstances.